Time being 6 o'clock, I'd like to call the Board of Health meeting to order. All members are present, as well as our Director of Public Health, Marty Golightly. Everyone please stand and join me in the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Move to our public announcements. Marty, announcements from the Health Department.
Sure, thank you. I just want to give a quick case update. 107 as of this afternoon. Our average age is 34.8. Our test positivity on Thursday of last week was 7.88. That is the highest it's been since January. 69.46% of eligible are fully vaccinated. I want to highly recommend the uses of masks in all public places, regardless of vaccination status, and we are still giving boosters and child vaccinations here in Town Hall. The constant contact was sent out today. If you want an appointment, you should be able to easily get one. If you can't, or if you have problems with electronics of any kind, just give us a call and we will happily make the appointment for you. 781-982-2119. And the state reported 13,717 cases today. That was about an hour ago. So please be safe over the holiday season. That's all I got.
Thank you, Marty. Any questions for Marty from the board?
Yes, I do. Still looking for those same Abington-specific hospitalization and death numbers, as that plays a part for what the town feels they need for themselves. And again, symptomatic to asymptomatic numbers for Abington. I know you have stated
For
many,
isolation?
Not for isolation. We've gone through this
Yeah,
numerous times that it's
maybe I'm not
not.
being 100% clear. So the symptomatic, asymptomatic for a case that's positive, if they're in isolation, the symptoms doesn't matter because they're not out in the public. So
Okay,
their symptoms or not having symptoms should not be a thought mechanism for what you should do or shouldn't do in public. That should more be a driver for test positivity.
My whole thought process on that is if there's 18,244 people roughly in Abington. If 18,244 people tested positive every single day, but nobody made it to the hospital and nobody died, is there a public health risk?
And if they're tested positive, they should be isolation away from everybody else.
I'm not asking that for whether or not they should isolate, Marty. I've said this many times.
Yeah,
every
know,
time that I ask you
symptomatic
this.
or asymptomatic shouldn't matter if someone is in isolation.
So
But we do have a file on all of the positive cases that we make contact with. Some of them we can't make contact with. And it's a moving target. So if someone doesn't have symptoms today and we can't talk to them tomorrow, they might have symptoms on that day.
Could that
So
be
it could
something
change
you
every
do
single
at the
day.
end of the 2-week thing? So if I test positive tonight, you're telling me that the health department doesn't have any involvement after that other than getting your case number?
When you say any involvement, I guess I'm unclear what you mean by that.
You were just telling me that it's too difficult for
We don't
you to check.
contact every patient every day, if that's what you mean.
Okay. Do you?
And there's no expectation for us to do that.
There is no. Okay.
No.
And then
So
my own-
symptomatic and asymptomatic is a moving target that is almost impossible for us to track, and doesn't matter if someone's in isolation.
Okay. Again, I'm not asking for whether that person should feel they have to be in isolation or not.
No, but that's what a
Running
positive
forward.
case means. A positive
Okay.
case is required to isolate for at least 10 days or until symptoms get better.
And I understand that. I'm asking for public information for asymptomatic to symptomatic numbers so that if everyone on this board tests positive but nobody gets sick, all the other people in the audience here will be like, oh, people are testing positive but nobody's actually getting sick and won't go out and do extra precautions. Whereas if everybody on this board tested positive, we all end up in the hospital, then yes, that's a case for other people to be doing other measures for themselves. I'm not asking to say, hey, this person is asymptomatic. That's not what I'm saying at all. What I'm saying is for extra precautions for other residents to know these numbers.
To know the number exactly who has been symptomatic or asymptomatic as of their test positivity date.
Yes, I feel we should have actual numbers. I don't want
If we can make,
guesstimates.
if we
You're
can
not
make
going to guess how
contact
many
with
cases
everybody,
there
that's still
are.
something that's, I can't promise you that's gonna be an accurate number every day though, because symptoms change every day.
You
So-
couldn't call at the end.
We have 107 cases right now. It's kind of difficult for us to contact every single patient and new patients every single day.
Okay, you couldn't wait till the 14 days up for
Isolation's only 10 days.
the end of the 10 days. You couldn't wait till that's up and make a friendly, hey, how is everything going as a concerned health agent of the town?
We have done that in the past, and if it's possible, we will do that. But it still doesn't matter as regards to whether or not it's safe out there. So,
Right.
I mean, I have no intention of doing that right now. If case numbers get to a manageable condition and we can figure that out, sure. But right now, you should use the test positivity rate, the hospitalization date for the county, because we don't have any Abington-specific hospitals, and all of the other ones for the county to make whether you should be out in public decision-making.
Does-
So, hope that answers your question.
Sir, does the hospitalization rate meet the same need? If we are not able to track asymptomatic versus symptomatic, does hospitalization rate for the county kind of meet the same need of what you're looking for? Because that
If
data,
it
I
was
think,
town-specific, it'd be a start.
if,
So if I may, we have an agenda item on COVID-19 safety measures. If we can table this discussion until that point in time, that would be great, because we're going to talk about that in a moment. So we have other things I want to get to before that, if that would be all right. So thank you, Marty, for your announcements. We can talk about COVID numbers such as that when that agenda item comes up. Moving to the next, so I have it under here as an announcement, but it was really kind of misleading saying that. We have representatives here tonight from the Mass Health Officers Association, the Mass Association of Health Boards, to provide some training to us on the legal authority of boards of health. Those representatives like to join us.
Do you want to get there?
Yes, that'd be great, thank you.
We actually are both from the Massachusetts Association of Health Boards. And I was asked, and I've done this on numerous occasions. Is someone else going
I'll do
to
it
do
for
the
you.
slides? Okay, great. I am Cheryl Sabara. I am the Executive Director and Senior Staff Attorney for the Massachusetts Association of Health Boards. We are a membership association made up of the 351 local boards of health, and we provide technical assistance and legal education to the 351 boards of health and their staff. Next slides, please. And I just told you all of that, so we'll go to the next slide. And I'm presenting this information for legal educational purposes only. The only attorney that represents the town of Abington is Abington's town council. So this is just purely for legal education. Next. This is what MAHB normally does. We have a legal handbook that has just been updated. It will be on our website by January 1st, and it is available for free for members of MAHB. We have been working for the past almost 2 years on COVID and creating guidance documents, working with the command center and with the Department of Public Health. We have a guidebook that's also on our website that anyone can download for free. We do trainings. They have been virtual for the past couple of years, and we are available to review any draft regulations that you might propose. Obviously, they would go to your town council for the ultimate review of them, and we can also provide some assistance if you're interested in drafting any local regulations. Next. I'm going to skip this because in the interest of time, I'm going to just skip that. When we look at local boards of health and what their legal authority is, we have to first look at federal law. And federal law really provides minimum standards. We often call that the floor. And then states can pass stronger public health laws. And the reason for that is that the protection of public health is within the police powers of states. And the federal government has delegated police powers to states. In Massachusetts, however, our legislature has delegated a lot of legal authority to local boards of health. And again, it's to protect public health. The protection of public health is really within our police powers, which sometimes is a hard thing for residents to wrap their arms around, because when they think of police powers, they think of police and fire. They don't think about public health as being within the police powers to protect the public health, safety, and welfare. Actually, zoning laws are also about protecting the public health, safety, and welfare. There are many, many cases in Massachusetts where courts have held that it is a widely accepted function of government to protect public health, even at the expense of an individual's freedom. And that's the balancing test that boards of health have to utilize all the time when they're making decisions, is that balancing test. And the courts have been clear that the right to engage in business must yield to the paramount right of government to protect public health by any rational means. Next slide, please. So in Massachusetts, we have the state legislature delegated much of its power to local cities and towns. The extent varies. Sometimes there's a sharing of power, like with the food code, for instance. The state also has the authority to enforce it if cities and towns aren't doing the proper enforcement. Sometimes they've delegated, the legislature delegates the authority to a city or town as the primary enforcing agent. In the sanitary code, you are the primary enforcement agent. In the tobacco sales law, you are the primary enforcing agent. Next slide. In addition, when you look at Chapter 111, which is the public health statute in Massachusetts, Section 31 is the section that gives you the local authority to pass local public health laws. Your laws stand on the same footing as a town bylaw, as a state law, or a state regulation. In addition, there are other specific sections in Chapter 111 that give you legal authority to address nuisances, noisome trades, refuse, house drainage, water. There are many, many sections in 111 that give you additional specific authority. Next slide. And this authority has been upheld consistently by the Supreme Judicial Court, which is the highest court in Massachusetts. And out of a case that I actually was involved in 2006, was a case where private clubs sued the town of Athol because the town had passed a regulation that was stricter than the state law. And the court upheld the legal authority of the Board of Health to do that and came out with a definition of public health, which I think is easy to grasp and is pretty poignant. And that is that the focus of public health is to protect the health of every member of the community. It's not about geography, that it was a private club. It's about protecting the health of every member of the community. Next slide. I'm not going to go through all of these, but you can read them on your own. But these are all cases decided in Massachusetts that upheld the legal authority of boards of health. Next slide. Another case when a court is looking to determine whether a regulation is illegal, they can really only look at, is the regulation reasonable? And if it's reasonable, if a person of normal intelligence could understand the regulation and the regulation is addressing a public health issue, the only time the Board of Health, the court would consider overturning a regulation is when whether it's arbitrary or capricious. They're not there to second guess the Board of Health. The Board of Health is the entity that weighs the evidence, finds the facts, exercises discretion. A court will not substitute its judgment for the judgment of an administrative body, unless that administrative body has violated someone's constitutional rights or has passed an arbitrary regulation that doesn't make any sense. Next slide, please. So here are some of the statutes that you will be involved in most of the times. And the first one is nuisance. And nuisance is a very broad section of the law, but it requires boards of health shall examine. It requires boards of health to look into nuisances, sources of filth, and causes of sickness. A lot of COVID activity in Massachusetts and across the country actually has been done pursuant to a nuisance statute. Does this activity, could this activity be a nuisance? Could it cause sickness? Could it cause or may it cause injury to the public health? Next slide. If the board determines that there is a nuisance in the town, then they have to examine, destroy, remove, or prevent that nuisance. And they can enact regulations concerning a specific nuisance. The one exception is generally acceptable farming procedures. I don't know if there are any farms in Abington, but if someone wants to eat a BLT somewhere, someone somewhere is going to have to smell a pig. It's that simple. So that's why generally acceptable farming procedures are exempt. Next slide. Noisome trade is another section of the law that is important in public health. And this is the section that permits boards of health to assign a site for a business that might be harmful to inhabitants, injurious to their property, or dangerous to the public health. So what boards can do in that case, if such an operation is coming into your town, like a body shop is one that's familiar, you have the authority to have that entity come before the Board of Health, and you could actually put some conditions on it. It happens with car washes or the commercial kind of vehicle washes that wash huge trucks in the middle of the night. There may be loading docks, things that may be noisy and maybe wouldn't be appropriate in a neighborhood, but would be appropriate in another area of the town. Next slide. So you have, your legal authority is very, very broad. But when you're deciding whether or not you should utilize that legal authority, there are a few things that you want to think about. Number one, is there a state or federal law that would prevent you from doing something? In other words, preempts you from doing something. And then you're going to want to look at a risk assessment. Is there a risk of harm to others? Is the risk to incompetent people? And what we mean by incompetent in this case is frequently our regulations we enact them to protect youth, to protect the elderly, to protect people with special needs. And then we want to think about when we're doing the balancing test between private individual rights versus public health obligations, where do we want to come out on that? Next slide. So we also want to think about whether the intervention is going to be effective. Many, many years ago, a couple of decades ago, the town of Brookline wanted to pass a Board of Health regulation that would prohibit the use of cell phones in cars. Now, this is the town of Brookline. So how was that intervention going to be effective? The last I knew, no boards of health had vehicles with sirens on them. They didn't have really the ability to confiscate. It was a public health initiative, yes, but was that going to be effective? No, because there was no way for the town to actually enforce a regulation like that. It ended up being done by the state legislature, and the enforcement authority was put with the police, which makes a heck of a lot more sense than a Board of Health regulation. Next slide. So, just because you can doesn't mean you should. You have the legal authority, you will be upheld, but there are other things that you want to consider, which is why there's always that balancing test that comes into play. Next slide. So, what are your statutory and regulatory obligations? I'm not sure that any of us really understand just how comprehensive they are. We put together a manual in 2016 that needs to be updated. Next slide, please. Next slide. Here are, and this was originally done by the Department of Public Health. We updated it in 2016. Here are just some of the statutory and regulatory obligations that a Board of Health has. Every Board of Health. Doesn't matter if you're Boston, Abington, or Peru out in Western Mass. Assuring safe drinking water, enforcing the state's sanitary code, the housing code, food protection, including inspecting restaurants, lead inspections, surveillance of communicable diseases, isolation and quarantine, vaccination clinics, medical and biological waste, and understanding what is biological waste and what is not biological waste. So I'm just naming a few. Next slide, please. Enforcing state and local regulations, the tobacco sales law. The knowledge base required to successfully accomplish all of these enforcement obligations is really great. It's comprehensive. Yet those are the laws that you are currently obligated to enforce. Next slide. So how do you meet these statutory and regulatory obligations? Next slide. Here are the laws that apply. The first is Chapter 41, Section 102B. In a town of more than 5,000 residents, if the town has accepted this Chapter 41, 102B, the Board of Health has to appoint a full-time health inspector who shall devote his time to the enforcement of the laws and regulations related to public health and such other duties as may be assigned by you, the Board of Health. I did some research and I couldn't determine whether Abington has adopted Chapter 41, Section 102, but whether they have or have not isn't going to change the next law, which is Chapter 111, Section 30, which says boards of health may appoint agents or a director of public health to act for them. And any agent or director shall have all the authority which the board appointing him had. Clearly, a Board of Health can't be out in the field answering complaints and doing inspections. I'm assuming you're not getting paid a full-time salary to do this job. And I'm assuming you probably have other jobs, which is why the legislature envisioned that staff would perform the duties and that a Board of Health would delegate those duties to a staff. Next slide. Inspections, another really important task for boards of health. Again, these type of inspections are normally done by trained inspectors. They're either done periodically or they're complaint driven. Your office gets a complaint, and even if it's anonymous, the Board of Health has the responsibility to investigate into that complaint. If the inspector is refused access, then the inspector gets an administrative search warrant from the district court or the housing court, whatever court has jurisdiction over the case, and then you would bring that search warrant back to the establishment that you need to search. Next slide. Enforcement. How does a board go about enforcing either a local regulation, a state law, or a state regulation? Several kinds of enforcement efforts. My first thought, what I always say to boards of health is, we're not about punishment. We're not the police. We're not there to punish someone. We're about compliance. We want to get to compliance. And if it means telling someone, could you clean up the dumpster? This is really producing a nuisance. We're afraid of some rodents. We've seen some. And they clean it up. Terrific. That's compliance. That's what we want. Sometimes that doesn't work. Sometimes we need to do more than just ask someone to clean up their dumpster. And that's where we have enforcement orders. We also can suspend or refuse to issue permits. Getting a permit from any municipal board, a building permit, a food service permit, a tobacco sales permit, those are not rights. You don't have a right to those. Getting those is a privilege. So you can refuse as a local board of health to issue a permit, or you can suspend a permit as long as you give notice and opportunity to the person who you feel has violated the terms of the permit. You have to give them their due process rights, which are notice and an opportunity to be heard. You can also issue fines pursuant to your cease and desist orders or pursuant to what a state statute or a local regulation says. And if worse comes to worse, you go to court and you can get injunctive orders against whoever the alleged violator is. Next section. Staffing. The state law gives the authority to employ staff to the local board of health. However, city and town charters can change that, and my understanding is in Abington, it's the town manager that is actually in charge of employing all staff in the town. Next slide. So what Chapter 111 says now in this case is really not relevant for Abington because your charter gives the authority to the town manager. Next slide. You would hope, however, and what is normally the case, is that the town manager and the Board of Health communicate and understand the roles and responsibilities of both the Board of Health and of the Board of Health staff. So I'm going to quickly go through legal liability, and that's the end of what I will be talking about. This is a state statute that provides cities and towns and staff of cities and towns with liability protection for anything that occurs that's either negligent or was a failure to act. If your staff or you do anything negligently, there is no personal liability that would attach. So the only way I can explain it really is intentional wrongdoing isn't covered. So if your staff does an inspection negligently, let's say he goes into a restaurant and knocks over a vase of flowers, maybe that would be a negligent inspection. However, if he went into a restaurant and did an inspection while he was drunk and punched the manager of a bar because they were smoking inside there, that would be an intentional wrongdoing, and that wouldn't be covered. Next slide. So who are public employers? For the purposes of this discussion, it would be the city or town. It would be Abington. Next slide. Who would be a covered employee? It would be, quick to the chase here, it would be your staff, and believe it or not, it would also be Board of Health members. Because you, even though you receive no compensation for what you do, you're considered an employee for the purposes of the statute. Next slide. So public employee were, I just said elected or appointed, full or part-time, compensated or uncompensated. Next slide. Subject to the direction or control. Again, this is going to be a factual question. Paid employees doing their regular job are clearly under the direction and control of the town, and Board of Health members are also under the direction and control of the municipality when you are representing Abington, not when you're out on your own, but when you're acting in your capacity as a Board of Health member, you are subject to the direction and control of the town. Next slide. So again, were you acting within the scope of your employment? This isn't an issue for board members, but for staff, it is an issue. Traveling from home to your office, you wouldn't be acting within the scope of your employment, but once you get to the office and you get a call to go out to investigate something, then you would be acting in the scope of your employment. Next one. So, if you're a public employee, a Board of Health member or staff, and you're acting within the scope of your employment, the municipality has to defend you. There would not be any individual liability unless you did something horrible and very, very wrong. Next slide. Additional protections are if you're doing something within your discretionary function. There is another section in the Mass Tort Claims Law that protects public employers from any claim based upon the performance or failure to perform a discretionary function, whether or not the discretion involved is abused. So next slide. And the purpose behind this statute is to not, there are many times where if you're addressing something that's controversial, either through an enforcement order or you're thinking about drafting a regulation, someone's going to say to you, I'm going to sue you if you do that. They're just going to, they say it all the time. Anyone can sue anyone for anything. But this statute is designed to prevent, to stop putting a monkey wrench in the business of a municipality. Because if every time someone said that you wouldn't do anything, then nothing would get done. So this exemption protects you from that. Next slide. Here's the best way to describe this is to look at this case that happened many years ago. It happened in the city of Lynn. And in the city of Lynn, when the city council was looking at building their budget for the next fiscal year, they looked at the amount of money they had, which was limited, and they looked at what they wanted to do, which was not limited, and they decided that they were not going to spend any money to put fences around playgrounds, and they also weren't going to do any snow removal around playgrounds. They determined how to allocate the limited money that they had. So what happens? A little girl was at a playground that had no fence around it and that had stairs, and she took her sled and went down the stairs that were all covered with snow and went right out into the street and was run over by a car. The parents of the girl sued, obviously, the driver of the car, but they also sued the city, saying that it was negligent for the city not to have put up a fence, that it was a really bad decision that the city made. Next slide. So what happened in that case? The city won that case because the court said that was a budget decision that the city made, and they made it based upon limited resources, and even if it was a crummy decision, they had the right to make that decision because they were exercising their discretionary function. So that's the definition of discretionary function. What isn't discretionary? How you drive a truck. You can't drive it in reverse, you can't drive it drunk, you can't drive it with your eyes closed. That's not making a policy decision. That's how you drive a truck. If you're driving it negligently, it's negligence. It's again not going to present you with any liability, but not because it's a discretionary function, but because it's negligence and you're protected from negligence as well. Next slide. Failure to act. This is my favorite one. Failing to inspect. So there is no liability on a staff member or on the Board of Health if you don't inspect a restaurant or if you inspect it negligently. Reason for this? Does this mean you're not supposed to inspect? No. It means if you're scheduling a routine inspection for a restaurant and you find out that you've got mold in a school, you're going to go to that school first before you do that restaurant inspection. So that's the purpose behind that law. Next. This was a relatively new slide that we added. These are the liability protections afforded vaccination clinics. And you'll see there's federal and state protection. There is absolute liability protection for administering, distributing, dispensing of COVID-19 vaccines by both healthcare folks and by anyone who is available to support the activities, including the planning activities of a vaccination clinic. There is absolute liability protection, and we have actually done a memo on that if anyone's interested in getting it, that really goes through all of the laws that are involved. And I think that's it. Next. Oh, that's it. Any questions?
Oh, yeah. So, personal question for you to start off with. Do you feel that the courts have held the public health has to be protected by any rational means, even at the expense of individual liberty? That doesn't bring a problem for you?
Well, if you, I don't know if you're aware of the Sixth Circuit Court of Appeal that just upheld the president's vaccination mandate. Again, it's a balancing test, and personal liberty is a constitutional right. Protecting public health is a constitutional obligation and duty. So when you're looking at those two things, you need to, and hopefully we're following the science here, if you're looking at those two things, which is going to come out on top? And it's a judgment call. There's no question that it's a judgment call. But when you're looking at, I'm assuming you're talking about COVID, or it could be anything else. But you know, we regulate personal behavior all the time. We require motorcycle helmets. We require smoke detectors. We require a lot of things that infringe on our liberty, and we do that to protect public health. So and again, it's going to be a judgment call that you're going to make, but every time the Supreme Judicial Court has looked at this in Massachusetts, they've held that regulations that regulate personal behavior, the ones that have come before them, are reasonable and they're upheld.
So I'm going to bring up COVID now because you brought it on. I was staying away from that. I don't have an individual liberty to not wear a helmet while riding a motorcycle.
No, there's a state law that requires you.
I don't have that right. What I do have a right to is a medical freedom. And I can say that this board member, the individual liberty would trump everything.
Well, you know, if that's the way, that's not the way scientists that have looked at this and have issued peer review articles, including one from the National Academy of Science, have ruled on this. Personal liberty, I mean, this came up a lot with environmental tobacco smoke. You know, personal liberty stops when it hurts somebody else, is commonly the doctrine that's followed in public health law. That personal liberty stops when it affects or could affect, through the nuisance statute, somebody else.
Okay. My next question is, you have in there, I don't remember which slide exactly it was, but it was talking about the nuisance, and that the board or health department could remove a nuisance. For example, would that be if I or any board member decides not to get a vaccine, that would be considered a nuisance and you could have us removed?
No, well, see, again, you have to go back to the balancing test there. Would that be a reasonable reaction for the rest of your fellow board members to take? And you're government officials here. So someone has an individual right not to be in the presence of someone that is not vaccinated, or to take precautions when they are in the presence of someone who is not vaccinated. I have a family member who is not vaccinated. I choose not to see her or her family because none of them are vaccinated.
And
But that's an individual decision that you can make.
I will say you also lost me a little bit using the word incompetence. 'Cause
I thought I explained that the word
You did.
incompetent, which
you
is a
explained
legal
what
term,
you mean by that.
I mean, as I said, there are 3 classes. It's normally youth, the elderly, or people with special needs. I made that very clear.
And you're assuming that the elderly, or you're assuming that people are not competent to understand what you mean by that.
No.
I think
You're
that's
taking a
wrong-
legal term and turning it
I
upside
think
down.
that's the wrong legal term to use.
Well,
You're assuming what somebody can comprehend.
Sir, I used that term in the context of when boards of health are passing local regulations. A lot of our tobacco sales laws, the rationale behind them was industry targeting of kids, and that we didn't want our kids to start, okay? The reason that housing codes have certain sections in them is for assisted living facilities. We have a lot of regulations surrounding assisted living facilities, around nursing homes. Those regulations are put into law because we want to protect our infirmed elders that are in those areas. We have lots of laws surrounding special needs, handicapped parking, the American with Disabilities Act. All of those kinds of laws are designed to protect those of us that have special needs. So that's the rationale behind a lot of public health laws. They're around certain sets of folks, and of course there are exceptions to every rule, but they're designed to protect people that need protection.
So if me being a board member made a motion tonight to restrict the driving of somebody that's elderly or special needs because they're incompetent they're part of the incompetent.
You don't have the authority to enact a regulation like that. You would be preempted by state law. State law does address elderly drivers.
Okay, and saying that these people are incompetent is that I personally would have chosen a better legal term to use than incompetent.
Well, you're
I think
free to
it's-
go to law school and choose whatever words you want to. I'm using a word that's in textbooks describing why we regulate. That's just a term but you're free to
And then
disagree with that.
My last question is about the liability. So if me as a board member on this body art regulation, if I feel a definition is one way, but then one of the tattoo shop owners out here tells me that this definition is different, and I don't listen to her, don't listen to information provided to me, and then that person turns out to be correctly, and there's a lawsuit involved in it, would I be held liable for that?
No, you would not. You made a bad decision, but you would be protected. And I'm assuming you didn't intentionally violate someone's constitutional rights when you decided on a different definition. There would be no personal liability that would attach for making a bad decision.
So who would then be held liable for something like that? The
Not
town?
that it would not be a city or town.
So, okay.
Any other questions?
I don't have a question. I just want to thank you very much. I really respect your time coming here with your credentials and your background and helping make some of this more digestible to ourselves. I don't have a legal background. I found this really helped frame
Good.
things to me better, so thank you very much.
Good, okay. Thank you very much.
No.
Can I ask a question to you?
It's not up to me to decide
Yeah.
that. Yeah, after the meeting.
Yeah, not in the public forum.
With our water, and where you had said that they're responsible because the chairman doesn't think he's responsible for our water. So we
So Wendy, we're not asking questions right now, please. You can ask her outside of our meeting. I can't conduct my business with you talking to her right now. Thank you.
That's your job.
Okay. I also want to remind our audience as well that any unauthorized recording is prohibited. You need to let me know before you hit record. So, if you're recording, please shut the recording off. We're being recorded by Abington Camp. Thank you. Okay. So, thank you so much, Charlie. I really appreciate you coming here tonight. Our next agenda item, we're actually going to move COVID-19 safety measures up to our next agenda item. So we're going to begin our discussion on that. As the board, and I'm sure the public is aware, we have a advisory in effect as of last meeting for masking in all indoor public places. Okay, so it's discussion from the board.
For discussion.
Yep.
So based on the numbers that we're seeing in Abington, with the trends going as they are, I do think that we need to continue the advisory at this time. It seems that public information, different reports coming out from our state, other states, and knowing that this is a season where we have a lot of people traveling and gathering in close quarters, I do think that we should continue with the advisory as it was. That's it for me.
Marty, with a mask advisory being put in effect, how long would it take for numbers to reflect?
At least 2 weeks.
At least 2 weeks? Okay.
Most
'cause
averages for these kind of things take around 2 weeks for us to see a up or a down trend.
Because I've been following the COVID numbers on that spreadsheet you gave every day, and the numbers have been going down, which is, it's too early to say that that's from the masks, correct?
I would say it's too early right now to say it's from the mask advisory.
Okay. So the Friday before we put the mask advisory in place, the number was 136. Over the weekend, which has 3 days involved in it, correct? You report that, you report Friday, Saturday, and Sunday. On Monday's numbers was 122. And then it stayed flat.
And, I'm sorry, sir, you need to leave. You need to leave this meeting.
record
I warned about recording, and I asked you to stop recording. I need you to leave this meeting. I'm asking you to leave this meeting. I have the right to leave this meeting.
I'm not leaving.
You need to leave this meeting.
I believe he told you he was gonna put it back on record.
It doesn't matter. I instructed you
Public
to,
space.
does not matter.
I'm not leaving.
Does not matter.
I'm not leaving.
Mr. Chairman, I move to adjourn.
I have a motion to adjourn. Do I have a second?
Second.
I have a second. All those in favor?
Aye.
Aye. Opposed? Unanimous. We are adjourned.
I oppose.